responsibilities as an investigator, I think, are primarily communication when it comes to working with patient partners or patient family advisors. And that's communication on all fronts, whether that's, first of all, meeting people where they are. So if my patient advisors prefer text message versus emails, then I'm going to send a text message. Or if they prefer a phone call to say hello and catch up at the same time as we might discuss some project aims or ideas, that's a great way to do it too. In academia and scholarship, we tend to use email as our primary mode of communication. It is handy and it is open all the time usually for us, but that's not the culture everywhere. And it's important to remember that when we're meeting with our patient partners and when we're engaging them for research work. So communication is the underlying value that I try and enact in all partnerships, but particularly with patient partners. Partners were involved from study design to, we're still in the midst of data analysis right now, but they'll be involved right up until dissemination of results in the community and involved with knowledge translation and exchange activities. So right at the beginning of our study design, we were wondering what the most useful research question we could ask might be for people here in Saskatoon. And I work in the area of substance use and substance use related harms. So our first task as a team was to really connect with people who are using substances, either actively or they identify as being in recovery, and speak with them about what needs to change, what are their priorities in the world, and for researchers to address what's the information they most need. So we really started right at the beginning of that study design with what's important to people and what answers do they want to find. And that guided our study design and implementation. And of course, I got the opportunity to bring some of my research training and skills to the table in collaboration with people with lived and living experience. And we were able to implement a successful project. So right from design there, we built the study around emphasizing and understanding the voices of lived and living experience of substance use. So that meant embedding people on our team, having an advisory along with our 2 patient partners on the project, and ensuring that that dialogue was ongoing to keep researchers accountable and to ensure that, that the community products we're creating out of this research are relevant and meaningful for the people that we're serving. One thing I would do differently, actually, is instead of assigning honoraria or payments for participation with our advisory committee, instead of doing that by meeting, our project was disrupted by the pandemic and accompanying closures and other things. So what I would do differently to ensure that the value of that participation is apparent and transparent throughout is instead of assigning sort of money and payments based on meetings, I would assign money and payments on a monthly basis for honoraria payments. So whether we've met or not isn't relevant. I appreciate those side phone calls. I appreciate being able to draw on expertise when it's needed. And that doesn't always come in the form of a formal meeting. So my patient partners, I've had the great opportunity to work with for over 10 years now in various projects and across our different areas of work. And it's been a real gift to have that relationship, and I value it every day.